Students, here in the first part of the lecture, I'll be dealing with all the questions which are related to this particular topic, cellular adaptation and metaplasia. For example, first question is one reversible process in which one mature cell type is replaced by another mature cell type is known as. Second, there is a replacement of columnar epithelium of respiratory tract into squamous epithelium. What is this condition is known as? Third, there is an image based question. Cervical biopsy is shown in the image. We have to identify what is the cellular adaptation. One patch which is showing columnar epithelium, and then there is a next patch of the tissue which is showing stratified squamous epithelium. Don't worry, we'll be dealing in these questions in detail in the theory section. There is a biopsy from the lower end of the esophagus shown in the patient, and patient is suffering from chronic heartburn. Identify type of the cellular adaptation. There are many questions to come, and for that we have to understand what is the concept of metaplasia. During this discussion, we will be dealing with definition, types, underlying mechanism, and the image based questions related to metaplasia. First important part which has been asked multiple times in recent examination, what is the definition of metaplasia? To be precise, in metaplasia, one mature cell or one adult cell is converted into another mature cell type. Again, one mature cell type is converted into another mature cell type. M for metaplasia, M from mature to mature, or adult cell type to adult cell type. This is the definition of metaplasia, multiple times asked in the recent examination. This is the entry level question, but there are many more questions to come from this topic. For example, is the metaplasia reversible? Friends, if you see here that I have put the arrow in both the direction, because if you remove the cause of the metaplasia, this process is reversible. Okay, so metaplasia is a reversible process in which one mature cell type is converted into another mature cell type. But what is the mechanism behind this process? Do we have ability in our mature cells to just transform into another type of mature cell? No, mature cell doesn't have that ability, but yes, stem cells they do have. Stem cells go under a process known as reprogramming. When they reprogram themselves, then they can differentiate into another cell type. So mechanism is stem cell reprogramming. Third types of questions are based on the what are the types of metaplasia in the pathology. So yes, types of metaplasia are two. One is epithelial metaplasia and second is mesenchymal metaplasia. Epithelial and mesenchymal, as the name suggests, epithelial metaplasia will occur in the epithelial tissue and mesenchymal metaplasia will occur in the mesenchymal tissue. For your MCQ, epithelial metaplasia is more common than mesenchymal. Okay, and among the epithelial metaplasia, squamous metaplasia is the most common type of metaplasia. Okay, so one MCQ, epithelial metaplasia is more common than mesenchymal. Second, squamous metaplasia is the most common epithelial metaplasia. In the first part of the lecture, we saw what are the different questions asked. Second, we saw that what is the exact definition and mechanism and types. In this part, we are going to see what exactly epithelial metaplasia is and what are the example. And for that, let's visit respiratory tract. Friends, try to remember what is the normal lining of respiratory tract, especially the upper one. Respiratory tract is lined by pseudostratified ciliated columnar epithelium. Each and every word is very important. This is pseudostratified. It looks like multiple layered, but it is actually single layered. Second, there are cilia present. Columnar type of epithelium, columnar type of cells are present. So, this is the normal lining, but when the patient is exposed to chronic stress in the form of chronic smoking, which is the most common cause here, this delicate epithelium, pseudostratified ciliated columnar epithelium, is a very delicate epithelium. It will be changed into another mature cell type, which is stratified squamous epithelium. It's not columnar, it is squamous epithelium. Okay, so there are three questions which are asked from this particular line. One is, what is the normal lining of respiratory tract? Second, what is the most common cause of metaplasia in respiratory tract, which is chronic smoking? Third, what is the type of metaplasia seen in the chronic smoker? Answer will be squamous metaplasia. So this was the story of respiratory tract. Example of metaplasia in respiratory tract is squamous metaplasia. Let's see the second example, which is cervix. Friends, again try to remember from your histology what is the normal lining of endocervix. Yes, you are right. It is simple columnar epithelium, single lining of columnar epithelium. When this particular type of epithelium, again which is very delicate, will be exposed to chronic irritation, chronic inflammation due to HPV infection, okay, human papilloma virus infection, which is chronic in nature, then this delicate epithelium will be changed into another type of mature epithelium, which is stratified squamous epithelium. Again, 3 MCQ from this particular line. One is, what is the normal lining of cervix? Second, what is the most common cause of metaplasia in cervix, which is HPV infection? Third, what is the type of metaplasia seen in cervix? Answer is squamous metaplasia. Diagrammatic representation can be done like this. This is a columnar epithelium, single layered. Remember that in the columnar epithelium, nucleus is towards the basement membrane. Okay, and then there is a chronic exposure, a chronic irritation by the HPV infection. Then particular epithelium is converted into this kind of cell type, which is multiple layered polygonal cells, and nucleus is present at the center. This is known as stratified squamous epithelium, type of squamous metaplasia. Okay, I'll be showing you histological image of cervical metaplasia also. You have to interpret it in terms of this particular diagrammatic representation. Third, very important example, ducts of the glands. For example, duct of the pancreatic gland or salivary gland. What happens that if you go to these ducts, the normal histology is usually stratified cuboidal epithelium. Okay, stratified cuboidal is a normal lining of the ducts. If these ducts are exposed to chronic inflammation due to chronic obstruction, examples stone. Okay, so chronic obstructions and stones are the cause of metaplasia in the duct. Then particular epithelium will be converted into stratified squamous epithelium. Okay, so 3 question: normal lining, what is the most common cause of metaplasia in the duct, and what is the outcome, what is the type of metaplasia seen in the duct? Answer will be squamous. One question is the normal histology, second is the cause, and third is the what is the outcome. Squamous metaplasia will be the outcome, and that's why squamous metaplasia is the most common type of metaplasia. Till now we are seeing only these and these types of metaplasia. Again, urinary bladder, very important in a case of schistosomiasis, in case of urinary bladder stone, which are again very common. What is the metaplasia seen? Remember, transitional epithelium is the normal lining of the urinary bladder. And when this transitional epithelium are irritated chronically due to chronic inflammation, chronic infection, example due to schistosomiasis or due to stones, this delicate epithelium will be converted now to another type of epithelium, which is stratified squamous epithelium. Till now we have seen that different type of cells are converting into stratified squamous, and that's why squamous is most common type of metaplasia seen. Now we are moving to the next example, which is a type of columnar metaplasia, and this disease is known as Barrett esophagus. Barrett esophagus is very important for your examination. Barrett esophagus is seen usually at the lower end of the esophagus in the patient of GERD, and it is an example of columnar metaplasia. Pathologically, it is columnar metaplasia. If I visit to the esophagus, normal lining of the esophagus is stratified squamous epithelium. From the upper end till lower, only few centimeter of the lower end is columnar, rest all is stratified squamous epithelium. MCQ from histology, what is the normal lining of esophagus? This will be the answer. Second thing, what is the cause of Barrett esophagus? When stratified squamous epithelium of the esophagus is exposed to chronic acid reflux, which is seen in the case of GERD, then this particular epithelium is converted into columnar epithelium, which is resistant to acid. Which type of columnar epithelium is resistant to acid? Intestinal type of columnar epithelium. Okay, if I had to draw it, then stratified squamous epithelium will be drawn like this: many layer polygonal cells, centrally placed nucleus. This is stratified squamous epithelium. In the case of GERD, now there will be patch which will be showing columnar cells. In between the columnar cell, there is another cell which is like a goblet. Okay, goblet is like a vessel which is used to keep the water or different drinks. So in between there is a goblet cell. These are the goblet cells. Goblet cells are filled with a particular material which is again very important for your exam. Okay, these goblet cells are filled with acidic mucin. They are filled with acidic mucin. And to test that this is the acidic mucin only, we can use a special stain. Name of the special stain which is used for acidic mucin, again recently asked. Name of the special stain which is used for acidic mucin is Alcian blue. AM for AB, it is Alcian blue. So Alcian blue is the stain used for acidic mucin. Alcian blue is the stain used for goblet cells, and goblet cells are present in the Barrett esophagus. They are not present in the normal esophagus. Okay, so if you put acidic mucin in this particular slide, this pink cells will be taking blue color. And this is very important demonstration of Barrett esophagus metaplastic change in the lower end of the esophagus. Try to revise it once, that what are the different examples we have seen in the case of respiratory tract, Remember friends, arrow should be both sided because this process are reversible. In the cervix, again it is reversible. In the ducts, reversible. But when it will be reversible? If the offending stress is gone. If you give the PPI to the patient of Barrett esophagus, then only it will be reversible. And that's why treatment of choice is proton pump inhibitor. You have to treat the cause, then metaplasia can be reversed. Remember this very important fact that metaplasia is reversible. Memorize it 10 times in your head. Metaplasia is reversible. Anaplasia is not. Dysplasia is not. But metaplasia is reversible. What is the problem with metaplasia? The good thing is metaplasia is reversible. But if dysplasia arises over the patch of metaplasia, usually metaplasia proceed to dysplasia, and if dysplasia arise over the patch of metaplasia, then this can be converted into cancer. So dysplasia is very harmful thing. Remember, what is dysplasia? Dysplasia is abnormal proliferation of the cell. This is a very abnormal process. Abnormal is the key word. Dysplasia is abnormal proliferation of the cell. And dysplasia is not a reversible process, it is partially reversible process. Dysplasia is partially reversible, means sometimes it can be reversed, but most of the times it cannot. And that's why if there is a dysplastic patch, we are worried. We usually go for some surgical removal of that patch from the cervix or from the esophagus so that cancer can be avoided. Fourth part of the topic is mesenchymal metaplasia. As the name suggests, this will be occurring in the mesenchymal tissue, for example, muscle, bone, etc. And very important example of this is myositis ossificans. The complete story of myositis ossificans is there is going to be history of trauma. Trauma history is very important, which is years ago. For example, patient has trauma in the thigh 5 to 10 years ago. In that particular part, patient has hematoma. Patient had hematoma in that particular part, but he didn't take rest, he didn't take NSAID, and because of that particular inflammation, particular hematoma was there for the long time. So no rest and no NSAID is associated with formation of mesenchymal metaplasia. This hematoma is causing chronic inflammation. And chronic inflammation will convert that particular tissue in the thigh into bony cells, and that's why in the later period patient will present to you with a hard nodule which will be painful. Okay, hard nodule at the same side which is painful is suspicious of mesenchymal metaplasia. So first clue, trauma. Second, years back. Third, there is no rest, no NSAID taken after the trauma, and now patient has hard nodule. If you go for the X-ray, there will be bone formation at the same site. This is the complete story of a condition known as myositis ossificans. In this particular condition, muscle cells are getting converted into bone cells. So one kind of mesenchymal cell into another kind of mesenchymal cell. That's why it is an example of mesenchymal metaplasia, and this disease is known as myositis ossificans. Before attempting to the questions, try to go through the lecture again and try to make complete notes of the metaplasia. Try to imagine it, and then you can brush up your knowledge with the recently asked question. Here, first question, one mature cell type into another mature cell type. Very good. Answer is metaplasia. Memorize it. This definition is very important. Second, replacement of columnar into squamous. Columnar into squamous. This is squamous metaplasia. Most common cause is chronic smoking. It can cause squamous cell carcinoma if smoking is continued. Overall, most common type of metaplasia. Third question, cervical biopsy is shown and they are asking about cellular adaptation. If you see in the right part of the image, you can see columnar cell. These are tall cells in which nucleus is present towards the base. This is columnar. Second patch, yes, this one. This is the squamous patch. Polygonal cell, round nucleus, centrally placed. Stratified squamous epithelium. In the cervix, if this is happening, what is the process going on? Squamous metaplasia. Other questions, what is the most common cause? HPV infection. Most common variant of HPV here will be HPV 16 and HPV 18. Coming up question, biopsy from the lower end of the esophagus is shown in patient with chronic heartburn, or you can say patient is suffering from gastroesophageal reflux disease. In the right side there is a normal mucosa which is dull, pale, whitish, but on the left side what you see is red velvety mucosa. In the gross, if you see red velvety, this is the suspicious for the Barrett esophagus. In the microscopic image you see a patch. I have marked that patch. This patch is stratified squamous epithelium. There are polygonal cells with the rounded centrally placed nucleus. In another patch, you see these columnar epithelium with basal nuclei. Okay, try to see them again. A patch of stratified squamous and patch of columnar. So stratified squamous is converted into simple columnar epithelium. Answer here is columnar metaplasia, also known as Barrett esophagus. Drug of choice here will be proton pump inhibitor. If we remove the stressing factor which is acid reflux, then next question, which special stain should be used for acidic mucin? AB for the AM. Acidic mucin is stained by AB, which is Alcian blue. Goblet cells are seen in esophagus, true or false? No, they are not seen in normal esophagus. This is a false statement. They are seen only in the case of Barrett esophagus. Which is this blue cell? If you use Alcian blue, goblet cells, they take blue color. These blue cells in the esophagus is goblet cells, only present in the case of Barrett esophagus. Most common type of metaplasia in respiratory tract, yes, squamous metaplasia. Most common cause, chronic smoking. It can give rise to squamous dysplasia, squamous cell carcinoma. Most common type of metaplasia in cervix, same. In the ducts, same. Most common nutritional metaplasia is, yes, it is vitamin A deficiency. and type will be again squamous metaplasia. Vitamin A deficiency most commonly causes metaplasia as which side? Most of the students make it wrong. They tick mark the skin, but it is respiratory tract which is the most commonly affected in case of vitamin A deficiency. Zuska disease is which type of metaplasia? Yes, this disease occurred in breast and it is a type of again squamous metaplasia. I'll be showing you image based question for the Zuska disease and then you will be able to understand it in a better way. Recurrent periductal mastitis is associated with. Remember friend, recurrent periductal mastitis is the name of Zuska disease. This occurs due to smoking and vitamin A deficiency. Due to smoking and vitamin A deficiency, recurrent periductal mastitis is also known as Zuska disease. Metaplasia is, yes, it is reversible. So these are the practice questions that we have solved. You have to make notes of all the concepts which I have dealt with the metaplasia. Then try to solve the MCQ. Try to make one liner from those MCQ. And at the last, we have to go to the image section. Try to make MCQs from the different concept, which is most common, what are the different types, this is reversible or irreversible, what is the cause at respiratory tract, in the cervix, etc. Barrett esophagus, very high yield. Myositis ossificans is important from clinical point of view. First, most important image, normal columnar epithelium. Try to visualize it with the closed eyes. Squamous metaplasia, and this is how it will look like in the histology section. This is the columnar epithelium and this patch is squamous. Zuska's disease, recurrent periductal mastitis, normal duct which is double layered, cuboidal and the basal myoepithelial cell. Another duct which is showing metaplasia, squamous epithelium keratinizing. Keratin will form abscess and abscess will come out in the form of fistula. This disease is known as Zuska disease, seen in the young female who are chronic smoker and deficient for vitamin A. What do you see here? Yes, we can identify two patches. One patch is squamous, multiple layer, so it will be stratified squamous. And if you follow that patch, we'll end up into another type of tissue here, which is columnar. They are forming glands. So this columnar epithelium, squamous to columnar in the esophagus, answer will be Barrett esophagus. A special stain for this condition is Alcian blue. Type of mucin in the goblet cell is acidic mucin. Bone formation in the X-ray, but this bone is present in the muscular plane. History of trauma, years back will be the key factors. Diagnosis will be myositis ossificans. Friends, revise these images again and again. You have to save them in your brain and then only you will be able to retrieve at the day of examination.